Hello, this is Natalie Tornese, Director of RCM at Outsource Strategies International. I wanted to talk a little bit about coding. Though medical diagnosis technology has developed rapidly, there are still situations where diseases cannot be clearly diagnosed. Uncertain diagnoses are given when the physician is unable to provide an accurate explanation of a patient's health problem. The 2022 ICD-10 Guidelines state that while specific diagnosis codes should be reported when they are supported by the available medical record documentation, along with clinical knowledge of the patient's health condition, there are still situations when signs and symptoms and unspecified codes are acceptable, even necessary. The guidelines state that you should not code a diagnosis which are documented as probable, suspected, questionable, rule out, compatible with, consistent with, or working diagnosis, or similar terms indicating uncertainty. Rather, you would code the condition to the highest degree of certainty for the encounter or visit, such as symptoms, signs, abnormal test results, or other reasons for the visit. According to the guidelines, signs, symptoms, or unspecified codes are the best choices for accurately reflecting the healthcare encounter in the following cases: when a definitive diagnosis has not been established by the end of the encounter, when sufficient clinical information isn't known or available about a particular health condition to assign a more specific code, when unspecified codes are the codes that most accurately reflect what is known about a patient's condition at the time of that particular encounter. When is reporting a symptom code appropriate? Additional signs and symptoms that may not be associated routinely with a disease process should be coded when present. If the symptom requires any additional workup or treatment, it would be advisable to report it in addition to the associated disease. So when should a symptom code not be reported? If a definitive diagnosis has been confirmed and the signs and symptoms are integral to the diagnosis, they are not reported as additional diagnosis. I will include a transcript along with this podcast to go over those codes. The 2020 ICD-10 Guidelines added the terms compatible with or consistent with to terminology that cannot be used to indicate uncertain diagnosis for outpatient services. The guidelines for patients receiving diagnostic services only during an outpatient encounter visit are as follows. For patients receiving diagnostic services only during an encounter visit, sequence the first diagnosis, condition, problem, or other reason for the encounter or visit shown in the medical record to be chiefly responsible for the outpatient services provided during the encounter and visit. Codes for other diagnoses, such as chronic conditions, may be sequenced as additional diagnoses. For encounters for routine laboratory or radiology testing in the absence of any signs, symptoms, or associated diagnosis, you would assign code Z01.89, encounter for other specified special examinations. If routine testing is performed during the same encounter as a test to evaluate a sign, symptom, or diagnosis, it is appropriate to assign both the Z code and the code describing the reason for the non-routine visit. For outpatient encounters for diagnostic tests that have been interpreted by a physician, if the final report is available at the time of coding, you would code any confirmed or definitive diagnosis documented in the interpretation. Do not code related signs and symptoms as additional diagnosis. The guidelines state if the diagnosis documented at the time of discharge is qualified as probable, suspected, likely, questionable, possible, or still to be ruled out, compatible with, consistent with, or other similar terms indicating uncertainty, you would code the condition as if it existed or was established. Here are some guidelines to follow. Document an uncertain diagnosis early if consistent with clinical indicators. Whenever possible, evolve the diagnosis to a definitive one. Recap all pertinent and relevant diagnoses in the discharge summary. Connect uncertain diagnosis with definitive signs or symptoms, which will help the professional coder assign an appropriate code. I hope this helps, but always remember that documentation and a thorough knowledge of payer regulations and guidelines is critical to ensure accurate reimbursement for the procedures performed.